And whereas on this occasion, African American Hepatitis-C Action Day, the City Council of the City of Tuskegee joins communities across the nation, joining together to reduce the high incidences of HCV infection in black communities by drawing attention to this neglected health disparity and promoting education, testing, and treatment. With our shared commitment, however, we can and we will end this epidemic. Can I hear you?
We can and we will end this epidemic.
Now, therefore, be it known that the City Council of the City of Tuskegee calls upon all Tuskegeans to get tested and, if needed, get treated for HCV. And we hereby proclaim this, the 25th day of July 2015, as African American Hepatitis-C Action Day in the city of Tuskegee, Alabama. That's tomorrow. However, we have not been able to mobilize in time to fully implement our program by tomorrow. So therefore, our local committee will be meeting on Monday and will determine another date. We are going to recommend to the committee that we set, if possible, this coming Friday as our day of Hepatitis-C Action Day in the city of Tuskegee. But in the meantime, we join with the rest of the nation in celebrating this, not celebrating, but commemorating and working and rededicating ourselves across this nation to testing and making the community aware of this serious life-threatening disease. And so it is my honor as mayor to issue this proclamation. I want to present it to the Honorable C. Virginia Fields, and so that she can take it. She is our honored guest. I have two special guests today, but I want you to take it so that since it is your organization that we're partnering with, and it is your organization that has initiated this National Hepatitis-C Day. And while you are here, I want to share resolution number 2015-95 in honor of C. Virginia Fields, President and CEO of the National Black Leadership Commission on AIDS, NBLCA. Whereas C. Virginia Fields is the President and Chief Executive Officer of the National Black Leadership Commission on AIDS, whereas during her tenure, the NBLCA has grown to include affiliate chapters in 11 cities nationwide and has led to implementation of noteworthy public policy achievements in domestic and international HIV/AIDS prevention, treatment, and care across our nation and the world. Whereas she was first appointed to the New York City AIDS Advisory Commission by Governor David Patterson, our good friend. Ms. Fields was recently appointed by Governor Andrew Cuomo, another good friend, to the New York State's Ending the AIDS Epidemic Task Force. And whereas Ms. Fields serves as a member of the New York City Council, served from 1989 to 1998. In 1997, Ms. Fields was elected, and I want all of us to give her a hand for this, was elected President of the Borough of Manhattan, New York, and later re-elected in 2001. And in 2005, she was a Democratic candidate for mayor of New York City, becoming the first African-American woman to seek that office. Now, therefore, be it resolved that the city of Tuskegee hereby wishes to thank Mrs. Fields for her life, serving the needs of this global community, and for helping to facilitate this meeting concerned with hepatitis C in Tuskegee, Alabama. Again, give her another good old Alabama welcome as we welcome her to the city. And she will be speaking momentarily. In the meantime, I would like to ask the Honorable, in honor of Deborah Y. Frazier Howes, Senior Vice President of Government and External Affairs at OraSure Technologies, Inc., to join me. Deborah, it's good to have you back in Alabama. Whereas Deborah Frazier Howes is Senior Vice President of Government and External Affairs at OraSure Technologies, a leader in the development of manufacture and distribution of oral fluid diagnostic and collection devices and other technologies designed to detect and diagnose critical medical conditions. I want to note that working with this organization over the last few years, the World Conference of Mayors, the National Conference of Black Mayors, we have gathered at Times Square on a number of occasions. We were scheduled to do it again recently, but I think Apple bumped us. You know, Apple is, we all know how big Apple is. But at any rate, before Times Square, mayors, we would come and we would test ourselves for HIV right on scene, as I'm willing to do today. As mayor of Tuskegee, it is my opportunity and responsibility to lead the way, to let everyone know that you should not be afraid to test. You ought to want to know if you're healthy. Why? Because help is not on the way. Help is available now, today. And it makes no sense for anyone to let stigma cause you to die. More people die from stigma than anything else because they are shy, because they are ashamed, they don't want anyone to know. Well, you can be ashamed all you want and some will come to your funeral. But let me tell you, I'm going to get tested because I want to know if I have HIV/AIDS, if I have hepatitis, if I have diabetes. And too many black people, Dr. Jones, die too soon from preventable diseases that are preventable and curable. We're about the business of curing. So OraSure has been that company that has made historic accomplishments in this whole area. Testing for HIV/AIDS, the quick test, and now they have one for hepatitis-C. And recently, I understand, there is one that's going to be used to detect the Ebola. And we all know how serious that disease has been. So let's give OraSure a round of applause for their technology. And I want all of y'all to know that this is, I have used their test, and we as mayors have done it in front of Times Square in New York City, so that the whole world, in front of NASDAQ, we do the simple test. And with the HIV/AIDS, it was simple, a swab of the tongue. And I think with this one, it's going to be a simple prick. And all of that will be explained by you experts later. But I'm going to be the first to take the test as mayor of this city, to set the example, to show that, first of all, it doesn't hurt. And then number two, it's better to know than to even hurt. I mean, it just makes sense. So we're delighted. During her tenure, Ms. Frazier Howes is charged with developing business opportunities and new markets for the company. Prior to joining OraSure, Mrs. Frazier Howes was the president and CEO of the National Black Leadership Commission on AIDS. So she was C. Virginia's predecessor. So they work hand in hand. Whereas for more than 2 decades, Ms. Frazier Howes has been recognized for leadership in the area of teen pregnancy, social welfare, HIV and AIDS in communities of color. She has advised 2 presidents while serving on the Presidential Advisory Council on HIV/AIDS, and Now, therefore, be it resolved that the city of Tuskegee hereby wishes to thank Mrs. Frazier Howes for her life serving the needs of this global community and for helping to facilitate this historic meeting here in Tuskegee, Alabama. Join me in letting her know how much we appreciate her service to humanity. Thank you, Deborah.
Thank you very much.
Now, what I'd like to do is ask C. Virginia to please come forward and make a statement, and Deborah to make a statement, and then Mr. Brackley and others of our committee. Yes.
Thank you, Mr. Mayor.
Thank you.
We're delighted to be here for such an important cause. On behalf of the board and staff of the National Black Leadership Commission on AIDS, whose mission is to educate, mobilize, and empower Black leaders in their local communities to address HIV/AIDS, Hepatitis-C, and other health disparities, we are very pleased to be here for this opening or the planning of this historic event to address HIV, or rather Hepatitis-C, here specifically in Tuskegee. And you will hear more about the rates of Hepatitis-C here in Tuskegee and why it is so important. So under the direction and leadership of Mayor Ford and the local planning committee, we are committed to providing resources, being a part of advocacy on the national level to change legislation and policies, to help direct much needed resources, to promote education, testing, getting people linked to care. And the good news, as the mayor said, there is treatment for hepatitis C.
Yes.
We want people to, first of all, become aware. Baby boomers, persons born between 1945 and 1965, have been identified by the Center for Disease Control as being a cohort most impacted, baby boomer generation. So we're going to be focused on them. But we also recognize in our communities, younger people are being affected, some because of more active intravenous drug use now, as well as tattoos and other risky kind of issues or behavior that might expose them to the transmission of hepatitis C. So we're going to be including that population. This is an exciting time, and we look forward to working with the leaders here in Tuskegee and the region in order to educate, in order to test, but most importantly, to get people treated. So the National Black Leadership Commission on AIDS is in the house. We will be here and look forward to working with all of you. Thank you, Mr.
Thank you.
Mayor.
Now, Deborah, please. Well said.
Thank you. Although African Americans represent only 12% of the U.S. population, they represent approximately 22% of the estimated Americans with chronic hepatitis C. Regardless of race and ethnicity, the Centers for Disease Control, as Virginia just noted, has called on all baby boomers born within the age cohort to get tested at least once for hepatitis C because of the glaring disparities that they found among that age group. We also know that people in prisons and young people remain at risk. We ask that people go out, get tested. The test is simple, it's easy, it's going to expedite you through the medical system so you will know whether or not you've been exposed to hepatitis C. Hepatitis C lives for a long time outside of the body. We have just come to the nexus where more people have died from hepatitis C than from AIDS in the United States of America. So we're asking everybody within the age cohort, and if you think you have any symptoms, to go out and get tested when the mayor and this local committee establishes where to get tested and when to get tested. I cannot tell you how delighted we are that this African American community with such a history in health would take it upon themselves to move the entire southern region of the United States forward as the model and example for the United States on how this should be done. And the place of Booker T. Washington and George Washington Carver,
Yes.
where people came here and were the first, for many instances, in this nation. This is the place. This is the place where this should be, and this is the time.
Okay.
Thank you very much.
Thank you so very much. What you did not say is this is the place where the infamous Tuskegee syphilis study occurred many years ago. Yes, they tested then. They found that the people were infected, but what? They did not cure them. That was a tragedy in history. Well, here we are in 2015. We are going to test ourselves. And if there is anyone who needs treatment, we will direct them to treatment. Thanks to President Barack Obama and the Affordable Care Act, and let's give our President a hand for his leadership. The Affordable Care Act, its goal is to make sure that no American is denied or lacks affordable, and that health care is accessible for all Americans. Unfortunately, our governor has not extended Medicaid. It means that many fall between that crack, and many, some 300 are projected to die in Alabama because Medicaid has not been extended. We'll continue to push for that to take place in the state of Alabama. But in the meantime, the Affordable Care Act has made insurance available for millions of Americans and thousands across the state of Alabama who never had insurance coverage before. And so if people, once they are tested, and we're asking for people to come forward, volunteer, don't be afraid, come forward, get tested. And if you find that you are positive and you need assistance, then there are agencies established to help you make sure you get help. There is help available. No person should be denied and should die of a disease that is preventable in the United States of America. But first we must educate, we must test, and then we must treat, and then finally we must cure. That is our goal. Our local committee, chaired by Mr. Ben Rackley, who has a distinguished career as a military leader and as a community leader. He heads TAHEC, the Tuskegee Area Health Planning Agency. He and our representative, Mr. Wayne Rowe from the Quality of Life, the two of them, they have considered to chair our local committee. And I want to ask Mr. Rackley to come forward, and we want to introduce the members of the local committee as well as our national committee members who are here. We have a local committee working on this, and of course we have the national committee as well. So Mr. Rackley, come forth. You and your co-chair. Thank you. Mr. Ben Rackley.
Good morning. My name is Benjamin Rackley, Executive Director of the Tuskegee Area Health Education Center. And this is Ella Robinson from Quality of Life. And we've agreed to co-chair the local initiative for education, for information dissemination, for testing and treatment. With that said, I'll yield to Ella for her consideration and any ideas she wants to share.
Great. Thank you.
Good morning. On behalf of Quality of Life, we're committed to testing patients in addition to providing continuity of care for those patients who need to be referred out to specialists. Thank you.
Great, outstanding. Mr. Chairman, let me just say that Quality of Life, we are really appreciative for Mr. Wayne Rowe, the Chief Executive Officer, is underway, not planning, but is already underway. He has bought 12 acres of land right across from the police department in the city of Tuskegee, and they will be constructing a $3 million, a new primary health care facility right here in the city of Tuskegee, Alabama. So thank you so very much. And we are thankful for his support. Now, we have Dr. Jones. Dr. Clifford Jones is one of our outstanding religious leaders, community leaders. I mean, just does it all 100 black men, and I want you all to come around, and he's going to introduce his national representative. Let's give him a hand. Dr. Jones, you do so much.
Thank you very much.
Yes.
I am Clifford Jones, and one of the roles that I want to play as president of our local 100 Black Men of America Greater Auburn Opelika chapter, which we are in the process of establishing a collegiate chapter here on the campus of Tuskegee University.
Great.
And we are happy to have Dr. Mark Alexander, who is our national chairperson for our health and wellness, which this falls underneath, and for the 100 Black Men. And he will certainly provide leadership at the national level, as I would do here locally. Mark?
Thank you. Thank you, Dr. Jones. 100 Black Men of America recognizes that hepatitis-C is a crisis in the black community, and it's largely been gone unnoticed. And so we are committed to helping to educate our communities across the country, to explain to our citizens the dangers of not being tested, not knowing your hepatitis C status. And so on behalf of our chairman, Curly M. Dossman, we stand ready to support our local chapter through the leadership of Dr. Clifford Jones, through the leadership of Mayor Ford and his local committee, and our national partners to do whatever we can to help eradicate this in the black community. Thank you.
Outstanding, great. Our social workers, Ted?
Yes, my name is Ted Phillips. I'm with the National Association of Black Social Workers. You know, as social workers, we believe in helping in any way we can, deliver any kind of service we can. So we will be going out educating folk about this serious disease and what can be done to help get rid of it.
Right.
Thank you, Mr. Mayor.
Thank you. Dr. Warren is not with us, but you can come and give your name, and we will continue our discussion with him when he comes from the Bioethics Center.
I'm Vantrese Hurd. I am Health Services Liaison for the National Center of Bioethics and Research in Healthcare at Tuskegee University.
Outstanding, great. On yesterday, we did have a chance to see President Johnson at Tuskegee University to introduce. We went by his office, and the Chief of Staff was able to give us a briefing about Tuskegee University for our guests who are in our city, and then later we did see the President, and on yesterday we had representatives, other representatives from Tuskegee University as well. Now, who else did we have?
Department of Health.
Oh, yes, the Department of Health, yes. On yesterday, and you can indicate who was here representing us from the Department of Health. And Mr. Rack, I want you to come back and also mention about the veterans, because we had Mr. McFarland from the Central Office of the VA Administration in Washington, D.C. On the phone, and he has committed and has been authorized by the VA system to be a part of this movement as well. Yes, of course, please.
I'm Sanquinetta Foster with the Macon County Health Department. That's our local public health office here in Tuskegee. And we also had our state public office here yesterday, Ms. Anderson from that office. And we're committed to doing whatever we can for the city of Tuskegee.
Great, outstanding, thank you.
As a veterans advocate for this community and others, I'd encourage veterans to take advantage of the opportunity to be tested for hepatitis C within the VA. The tests are available at no cost to them in most instances. So for veterans who qualify for health care, who are enrolled in the VA system, I would advocate that they take advantage of this opportunity to be tested, and if found positive, to be treated and cured. Thank you.
Outstanding. Oh, did we introduce everyone? Introduce. Okay. She's with a part of Deborah's team, and this young lady.
She's part of my team.
Okay, part of your team. All right, so you see we got a great team here. A great looking team, too. Great. Now, come around, we're open to any questions that the press may have. We're open for any questions. And if I can't answer it, I've got a team here. Any questions? Okay. Now, as I said, tomorrow is Hepatitis-C Awareness Day. You may want to say more about that, see, Virginia, what's going to be happening across the country. As I said, this is our first time really knowing about it here, so we were not able to gear up in time to really do it the way we like to do it in Tuskegee. So we're going to meet again on Monday and get our date set. But tell us about what is happening across the country.
3 years ago, the National Black Leadership Commission on AIDS with 2 other local organizations launched the National African American Hepatitis-C Awareness Day. And we did it out recognizing the need, as you've heard here today. There are approximately 5.2 million persons nationally, according to the Center for Disease Control, who are living with hepatitis C. African Americans are disproportionately impacted. So we wanted to have a special awareness day to draw attention nationally to this virus, this disease, but more importantly, the treatment. So this is the 3rd year, and the date is July 25th. And on that date, we ask organizations around the country to do several things. Hold press conferences to create more awareness, do testing so that, again, people can know their status. And for those who are positive, link them to care, treatment, and ultimate cure. The cure now, the treatment now, is approximately 12 weeks. I think, as Deborah Fraser-House stated earlier, tremendous progress in that area. There is one pill a day that a person can take over a 12-week period, of course monitored by their physician, and can be cured. So we wanted the larger community to know this. This year, our 3rd year, we now have over 70 organizations nationwide who will be doing one of several things tomorrow. Educating, awareness, testing, holding health fairs, as well as visiting legislators' office. Actually, they're doing that today, this being Friday. And it's happening in approximately 23 states. So in our 3rd year of this initiative, we're beginning to see progress. And the very special part of this year is being here in Tuskegee, announcing the launching of a Cure the City initiative that by this time next year, we will stand here and be able to tell you the progress that we have made in this initiative that we hope to see, as you have heard, replicated throughout other parts of the South.
Okay, wonderful. Thank you so very much. Ms. Robertson? Great.
Yes, I would like to know, for someone seeing this,
Yes.
and they were interested in being tested, especially if they don't have a personal physician, where would they go right now to have an opportunity to be tested?
Well, they can go obviously to the local centers. We have a primary health care center. The Thomas Reed Center is one, and we have Quality of Life, which is located here in our city. And any normal health agency can give the simple test, the test. Now treatment, when it comes to treatment, that's a more specialized effort, but once they are tested, then they can be recommended to a specialist or to the appropriate doctor to go for. And for the veterans, you can come and say again, for the veterans who are listening.
Yeah, again, veterans are encouraged to be tested within the VA, and if they're found to be positive, then treatment can begin based upon the resources available. If not, they will send them out for appropriate care.
Great. And we were very pleased that, as I said, the National Office of VA called and indicated that they are with us in this effort. You know, which one of you know Dr. The gentleman who was... Yes, you may want to speak in for the veterans.
Yes, in regards to the Veterans Administration, we understood yesterday from their national office that they've already identified more than 240,000 veterans in the VA system who are confirmed with hepatitis C. On a weekly basis, they were looking at about testing 800 of their veterans per week. There's a high correlation between the Vietnam War and people who have come home with hepatitis C. You all know that hepatitis C can go undetected, very much like HIV, for decades before it begins to affect the liver. So what we're seeing now, and the same thing that we're seeing with the birth cohort, those baby boomers born between 1945 and 1965, who do not necessarily have a military history, and we're seeing that fivefold in the VA for the same age group of population. So we really urge veterans to go out and get tested.
Okay. Any other questions or points, Ms. Robinson, that we missed?
Well, I was just wondering if they have to pay, you know, we said they might be covered by the Affordable Care Act. If somehow they are in that group that has no money, would these agencies be able to direct them to
where they can
sources
go,
where they can get
where
the
they would not
test?
have to be
Yes.
paid. What we all need to know is that there are some people who are not covered. And one of the things that we will be doing is seeking resources. For example, I want to publicly thank OraSure. They are going to make up to 200 of these kits available at no cost for our testing day here in Tuskegee. One of these probably costs what? Well, anyway, we won't go into that. They cost money. They cost money. And so the point is, that's part of what we will be doing, is we will be marshaling resources. We'll be calling upon the pharmaceutical companies. We're going to be meeting with the head of the CDC. We're going to be meeting with other officials. We've already been in touch with the White House. I have a letter going to President Obama and Valerie Jarrett at the White House, because the White House has made this a top priority. All of this is in keeping with the President's Affordable Care Act. And there is no excuse for America to not have the ability to treat anyone who has a preventable disease in this country today. We must find a way so that no one is turned away. Hospitals that are funded through Hill Burden funds and other sources, they have an obligation to make through their indigent care resources, treat and test people who come to them. No one should be turned away. But we are going to be busy. That's going to be the work of our national committee. And I want to thank our national leaders who are here. We're going to be helping to identify resources and money to make this effort happen. But we've already started. We've identified 200 of these kits that will be made available for our kickoff. So on that kickoff day, which we're projecting that will probably be this coming Friday, but we'll meet on Monday, finalize that. And once we finalize it, we will get it out, because we have a way. If you don't believe we can get the word out in Tuskegee, just a month ago, we had a free health program provided by the military. And we had more than $1 million of free medical services provided by the United States military, the Army, the Air Force, the National Guard, the Marines, their doctors and their nurses and their other medical staff came here, and for more than a week, for about 10 days, they provided at our local public school, Tuskegee Institute Middle School, they set up and they treated people. They gave them, not only did they test their eyes, but they gave them a pair of free eyeglasses. They also tested them and treated them for dental. They gave them the dental test, and they also did dental work, and more than $1 million of free medical service provided by the military. So this is a continuation by the city of Tuskegee to reach out and to bring resources to bear here in the city of Tuskegee so that my people, our people in this city will be able to be treated. I want my people cured, and I want us to always be able to say, never, never again will we allow our people to be tested and turn our backs and not make sure that they get treatment and cure. We're committed to this. And if we can't get it done, it will not be because we did not try. Thank you so very much. We'll end on that note.
Thank you.
Thank you.
Thank you.